Okay, the last one, Dr. Sarita. Sorry, Ravindran.
So good afternoon. My topic is my topic of study was health-related quality of life in adult patients with strabismus. While a lot of importance is being given to the clinical and surgical aspects of strabismus, the psychosocial and functional aspects are seldom emphasized. So health-related quality of life provides a comprehensive assessment of the physical and mental impact of the disease on the patient. AIOS20 is such a validated questionnaire which provides insight regarding the same. So the aim of my study was to evaluate health-related quality of life in people with strabismus using the AIOS20 questionnaire and to determine the association between HRQOL and the type of strabismus. So it was a single-center study comprising of 83 patients and included adults more than 18 years. We excluded patients with history of previous Squint surgery and history of psychiatric or debilitating illness. All patients underwent a comprehensive ophthalmological examination, a Squint evaluation, after which the AIOS20 questionnaire was administered. The questionnaire has 20 questions, 10 in each of the subscales, psychosocial and functional, and the scoring was based on a 5-point Likert system, where never stood for 100 and always stood for 0. The psychosocial subscale had questions like if the patient feels inferior, uncomfortable regarding the eye status, and the functional subscale included questions regarding depth perception, concentration while reading, etc. So the AIOS20 scores were the statistical mean of the 20 questions, where 0 stood for the worst quality of life and 100 for the best quality of life. The mean AIOS20 score was 51, which was on the lower side. There was no association between age and AIOS20 scores or gender, type of strabismus, or degree of strabismus. Poor presenting visual acuity in the better eye was associated with significantly lower scores in our study. So the median AIOS20 score in a non-strabismic individual is 85 to 100 according to SR Hat, who was the one who derived the questionnaire. So the findings of our study concurred with that of SR Hat, where quality of life was found to be poor, affecting both psychosocial and functional subscales. Other authors have found that patients with strabismus, adults with strabismus, reported higher levels of social anxiety when compared with age and gender matched controls. Some other studies found that they exhibit lower levels of perceived happiness and heightened rates of depression to their non-strabismic counterparts. Our analysis revealed that the mean AIOS20 and subscale scores were low irrespective of gender, and the difference was not statistically significant. While other studies showed lower scores among females. This is probably because of the local in the localites considered squint in females to be a sign of good luck. The esotropes in our study seem to have markedly lower scores than exotropes, p is equal to 0.056. Although a trend was seen, this study was not powered enough to explore the effect of differences among subgroups. And though our study had no significance, found no significant association between degree of strabismus and HRQOL, some other studies have found that a deviation of more than 10 PD was associated with a higher psychological impact. Poor presenting visual acuity was associated with lower psychosocial scores in the better eye, and a lot of other studies concurred with the same findings. So the observations in this study were that patients did not seek treatment, both medical or surgical, due to poor awareness as well as local beliefs. We consider the possibility that visual acuity could be a confounder, and we analyzed the associations between age, gender, type, and degree of deviation with the AIOS20 and the subscale scores. The results were still statistically insignificant. So to conclude, our study has found that health-related quality of life was reduced in all patients with strabismus, irrespective of age, gender, onset, type of strabismus, and degree of deviation. Irrespective of refractive status, poor vision in the better eye was associated with lower score and significantly affected the quality of life of adults with strabismus. Thank you.
Thank you. Thank you. Any question from the audience related to everybody? Thank you. Thank you.
Thank you.